Look at my face. Look very closely into my eyes. What am I feeling right now?
You're feeling good about life.
I am feeling better than that. I am feeling...
I know what you're feeling.
Dynamite! It's time to ask the gyno! I can't believe you didn't see that in the eyes.
It
gives it away every time. So Dr. Nita is here and ready to deliver answers to your biggest OB-GYN questions, like this next one from viewer Kacey.
Hi, doctors. So I've had periods since I was 11 years old, and they've been so difficult. I've had blood clots ranging from pea size to half-dollar size and everything in between. I'm on birth control, but it still happens. Do you have any idea what can help me, please?
Dr. Nita.
What's going on here?
Yes, so with the blood clots, let's just quickly talk about how these blood clots form. So basically, from an anatomical standpoint, at the bottom of a woman's uterus, you have her cervix, and the cervix has a small opening. Well, as the uterine lining sheds, then the blood has to come down and it goes through the small opening and then through the vagina, right? Right. So if you're just having a little bit of bleeding, then it can just pass through the blood and the tissue. But if you're having a significant amount of bleeding, it can take time for the blood to move through the uterus, through the hole, through the vagina, and then out onto your menstrual product like your pad or your tampon. And when that happens, you can get blood clots, right? So that's kind of why the blood clots form, if it's taking a while for the blood to make that trip to your menstrual product. Well, if you're having problems with clots, and the clots are small, meaning they're smaller than a quarter, and you're only having them every now and then, so not very frequently, it's not a big deal. But if you're consistently having blood clots the size of a quarter or larger, then you definitely want to see what's going on. Your doctor's going to want to investigate, and they're also going to want to do a blood test to make sure you're not anemic, to make sure you're not bleeding so heavily that your hemoglobin has fallen.
And what kind of conditions can lead to excessive bleeding and the formation of these clots?
We think about a lot of different things. If a woman is not pregnant, there can be anatomical reasons. So you can have uterine fibroids, you can have endometriosis, perhaps you have an endometrial polyp or something. There can also be hormonal issues causing irregular bleeding, and that can cause heavy bleeding leading to the blood clots. Also, you want to make sure there's no type of cancer. In her particular case, she's always had the heavy bleeding, so I don't think she has cancer per se, but that's something you want to take into consideration. I will say sometimes if someone is not an ideal body mass index, especially if they're overweight, then they may not ovulate regularly, and that can cause the tissue in the uterus, so the uterine lining, to grow, and then it just kind of continues to grow until it outgrows its blood supply, and you can have some heavy irregular bleeding, and that can lead to some abnormal cells in the uterine cavity. So those are things that definitely need to be investigated.
So let's say you investigate and you determine that there is no major serious problem. What kinds of ways can you reduce the clotting?
So our go-to is going to be estrogen-containing birth control pills if you're a good candidate. That can decrease blood flow by 50%. Also, some other hormonal treatment options, so some other hormonal medications that may not be birth control are sometimes used. Also, you can think about the Mirena, or you can think about a progesterone-containing intrauterine device. That can decrease blood flow up to about 90% in some women. After about a year, some women will stop having periods altogether, which is okay. So that can't freak you out either. It's okay not to have a period if your doctor knows why you're not having a period. So you have some options. Additionally, ibuprofen or something called tranexamic acid is an antifibrinolytic. So a lot of different options out there.
But it sounds like if you're regularly experiencing blood clots of this size, don't have any answers, you really need to get a workup as an individual, because various things could be causing it. Even if it's benign, there are treatments that can improve the situation.
Absolutely.
Dr. Nita, that was a dynamite answer.
It was.